Hello, everyone. How's it going? So it is a Monday night, and it feels like a Saturday night to me for some reason. And maybe that's because I'm home a little bit earlier than anticipated and expected. I have a few minutes to myself before my son gets in the house. And so I thought I'd take advantage of this time real quick and just try to come and pop on. I've never actually gone live in this particular group, so I thought I'd try to diversify a little bit and pop in live in a new group. So for those of you who do not know me, my name is Bridgette Montgomery, and I am a master social worker, and I'm a licensed clinical social worker. Some of you probably have seen some of the stuff that I've done in the group, some of the inspirational stuff I might post, or some of the work that I've done and I might post in the groups for your learning benefit and for your support with taking the exam. And so tonight I'm just going to try to make this really quick, not too long or drawn out. If you have any questions, you can pop questions in the comment section for me, and I will try to answer them as I go along. But this is just going to be real quick. Just want to give you a quick tip for taking practice questions that will ultimately turn into what you would do on the practice exam. So again, this is just real quick, so nothing too fancy, nothing too in-depth. I just try to just give you some simple techniques, something that could be useful, something that could be beneficial. So let's just go ahead and move right on along. And if you hear a whole lot of noise in the background, that's the kids out front playing. They are enjoying this weather. They're taking advantage of it. And I'm a little bit jealous, but kudos to them. Okay. So, all right, we got some folks that's taking their exam this week. Congratulations for jumping out there and the courage to go ahead and plunge forward to, get this exam done. Just have no fear. Just go in and do what you got to do. So hopefully this little tip will be something that you could take into the exam room with you. So let's see what we got going on here. Oh, excuse me. Okay, so identifying the problem in the vignette, that is the key to answering the question. So the most important thing I think I would like for you all to get and take away from this little snippet is that your primary role in answering test questions, particularly those that are more analytical in nature, is to find the situation or the problem that needs to be addressed in the here and now. And so we're looking for, in that vignette, what's the issue, what's the problem, what's the situation that we need to address right now in the here and now. A lot of times the way I try to think through that, I think about a dialogue, a conversation. So if I'm having a conversation with someone, I might say something to you, and the last thing that I said to you pretty much is that thing that you're most likely going to respond to. Not all the time, but most likely is the last comment or the last thing that I said to you that you're going to make a response to, or that you're going to respond back to, that you're going to address. And so when we're thinking about the problem that we need to identify in the vignette, we want to pay attention to that thing that's being said that is concerning, that we need to respond to immediately, that we need to address right here in the right now. Keep in mind that your answer response should always answer the question that is being asked of you in the stem. The question that is being asked of you is directly related to the problem in the stem. And so it is your job to identify that problem and to find the best answer response for it. I highlight the best answer response because that will eliminate the need for you to search for the correct response. So in situations like these, there are so many ways that we could come up with responding to the question being asked, and trying to find the correct answer response can become extremely frustrating. So think about that, right? You have a way of responding to situations. I have a way of responding to situations. And there are a multitude of ways that we can answer, or deal with a problem that's being presented to us. But keep in mind that this is a standardized exam. And so the way that the questions are going to be designed on the actual exam is written in such a way that if we're all thinking in terms of what's being said to us or what's happening in the situation that we need to address, we should all derive at the same answer. Okay, so that's really important to keep in mind. Finding the correct answer response is based on how we all interpret a situation. Furthermore, our rationale for how we interpret that situation will determine how we decide to solve that problem. So it's absolutely important that you keep in mind that you are only given 4 choices to choose from, right? So in trying to find a correct answer choice, if you're only given 4 choices and what you're thinking in your head should be the answer because of the way that you think you should answer the question is not there, you're going to get extremely frustrated and you're going to get lost and you're going to lose focus. And so you're not looking for an answer. You're not looking for the way that you would respond to that question, but you're basically looking for what falls in line to what's being asked of you and what are the choices they're giving you to choose from. And of those choices, which one is the best answer or the best response for this particular question being asked. Okay? Now, understanding that there is only 4 answer choices, right? Your answer choice should be based on your practical knowledge, which is theoretically based principles. That's everything that we're studying, the Piaget's, the clinical interventions, the Mullers, the Freud stuff, the Erikson 8 stages of social development. All that stuff is considered the theory. So your answer should be theoretically based, right? It should also connect to your skill sets, which derives from the evidence-based practices, right? So that's like your CBTs, your motivational interviewing, your DBT, your psychoanalysis, your psychodynamic approaches, your mindfulness, all that stuff. These are your evidence-based practices, right? And the skill sets that derive from those different types of clinical interventions. And your ability to be able to analyze, problem solve, and understand how to manage dilemmas, which comes from our NASW Code of Ethics. So let me say that again. Right? Your answer choices need to be based on your practical skill and knowledge, right? Your practical skill and knowledge is the theoretical based information that you're studying. If you understand the theory behind what you're doing, when you come across these questions, you can apply theory to practice. This is not about taking practice and applying it to theory. We're doing it backwards. We're taking our practical experiences, what we do out there in the field, and try to make it fit into the situations. When in essence, what we should be doing is taking the theory and applying the theory to practice. Now, if you're looking for the questions to be written in such a way that's going to be kind of like a recall type question because you're studying all this stuff, you're trying to memorize all this information in hopes that the vignettes will be written in such a way where you can regurgitate that information, you're going to do yourself a disservice. So you're studying this information to understand it. You're studying it with the purpose of internalizing, making the connection, getting a clear understanding of what it means and how can you apply that information in practice. That's what this exam is all about. Taking theory and applying it to practice. I hope that made sense to you guys. If I'm making any kind of sense, just write in the comment section that you understand and it makes sense. All right, let's move on to the next screen. The next important tip that I want to leave you guys with is do not compare test questions, okay? This is so important. And what tends to happen, because we're practicing and we're studying and we're reading so much, the urge and the desire to start comparing test questions, it just happens. It happens unconsciously, okay? So comparing test questions can be a very dangerous thing to do, as it could set you up for failure. Every question given should be thought of as being unique and separate from any questions that you read or answered before. Each question should be approached and treated as a new and distinct situation that you are dealing with for the first time. If you have read and answered any questions that appears to be similar to the one that you are currently working on, chances are you will want to answer that current question in the same manner that you've answered the previous question before. As tempting as it may be, please avoid doing this. One word could change the entire meaning of the situation, which could require a very different response, and that could ultimately create a different outcome. You need to be cognizant of this and aware of the urge to answer a question in like manner because it was similar to the one that you read before. Please read every question and every word carefully. Now, if you haven't heard this before, I'm going to say it to you now. This is a reading exam, and you are being assessed on your ability to be able to read and comprehend and interpret the information as given. It is a reading exam, and you need to understand that as such. It's assessing your ability to be able to comprehend what's going on. If you don't understand what's going on in the situation, how can you analyze and problem solve? Okay, so this is what it's all about. Think about what you do on a daily basis as social workers, right? What we do is assess, analyze, and problem solve all day long. We have clients coming into our offices all day long. They're coming to us with different situations, with different circumstances, with different problems, and we have to hear them through thoroughly. We have to understand their situation, and then based on what they're presenting to us, we begin to assess and analyze what is going on and what we need to do next. And we help them, we assist them, we encourage them as we work through problem solving to come up with a resolve. This is what we do on a daily basis. You guys have the technical skill and knowledge to do this. And so I need you to keep that in mind and to remember that. So when you're reading these questions, understand you're reading for understanding so that you could get a clear picture of what's going on in this situation. You can assess it properly. You can analyze and pull it apart and then problem solve and come up with the best answer response. All right. The next key to remember, all right, the last thing, think about this. I kind of like just gave you a scenario, right? So we all have a client system that we see on a daily basis. When I talk about a client system, I'm talking about the individual person, a family, a couple, a community, all those different things that make up our client system. Some of us may work with a large caseload, while others may work with and advocate on behalf of communities, and some may impact and affect change in law and politics. No matter what area of social work you are in, each entity that you come in contact with is unique and have individualized needs, right? What makes our consumers or our constituents or our clients unique and different is that each one has various experiences, different cultural backgrounds, and different upbringings. Because of this difference, we must approach each individual as distinct and unique and as one who deserves the right to have individualized services. Just because you may come across a client system that may have had a similar situation to a previous client that you worked with before does not mean that you should take the same treatment or clinical approach to address that client system specific problem. This is a mistake that many professionals run into when they fail to see each client system as individual and unique. Okay, this same faulty approach tend to happen when folks are answering test questions. Being too hasty and allowing yourself to become too settled and content in what you're doing puts you at risk in selecting the incorrect answer choice and ultimately leave you and the client with an unresolved issue. You need to read each and every question thoroughly and approach it as if it's the first time you've read that question or come across that situation. Okay, so I don't care how similar the question may seem to one that you've read previously or you've answered before. Every single question that you come up against, read it all the way through, approach it as if it's the first time you've ever seen that question, and treat it accordingly. Think of the practice questions as your client. Every client we serve, as I already said, is an individual. They each have needs that are specific to them. You must address and treat the individual according to his or her specific needs. There are no quick fixes, no routines, or no systems to treating problems. You need to assess and analyze what's going on and respond to it accordingly. What makes social work such a unique behavioral and mental health profession is the skill set and the training that we acquire as social workers, right? Our training enables us to be able to assess and analyze what's going on, process and reason through the situations, and problem solve to come up with a resolve. Our training has taught us about the various types of theories and perspectives. It has equipped us with the fundamental and practical skills we need, and it has given us the knowledge and the ability to carry out the duties and responsibilities of a qualified and professional social worker. That's who you are. That's what you possess. That's what your training has given to you. Now, use the knowledge, the skill, and the ability that you have acquired to guide you through this testing process. Y'all got this. Trust me, you got this. Trust yourself. You got this. Now, I just want to bring this to a close before I give you a quick practice question. Yes, I do have a practice question for you, but let me just bring this to a close real quick. So, when you're given a vignette or the vignette that you've chosen, right? I like to think of the vignettes as being our client or a client system, right? So we want to read that vignette and we want to be able to identify and find the person or the individual or the situation or the family or the community, whatever, who is in need of the immediate support. And we need to carefully read and examine what is being asked of us, okay? So make sure you read every single word. I can't stress it enough, and find out exactly what is being asked of you. You need to be able to identify the problem, analyze and assess the situation, and apply the appropriate skill needed to assist the client in resolving their problem. Again, you have to identify the problem. Once you identify the problem that you need to address in the here and now, analyze and assess that situation. What's going on? Ask yourself, what's going on here? What content area is being assessed? And then apply the appropriate skill that you need to assist the client with resolving their problem. Okay? Analyzing involves using higher order reasoning skill and ability. You must be able to adequately draw inferences and synthesize information. This is very different than assuming, okay? When you're drawing inferences, you're reading between the lines. You're taking prior knowledge and you're tying it into what is being stated, the facts of what's being shared. And then you synthesize, you bring it all together to understand what is actually going on, okay? Being able to draw inference and synthesize information comes with having a clear understanding of your theoretical knowledge base, right? The theories, Freud, Piaget, Mahler, all that stuff, right? And being able to read between the lines without drawing assumptions to come up with your conclusions. So the two major things that I talked about this afternoon, one is being able to identify the problem in the vignette. Two, not comparing any test questions to each other. And then lastly, understanding that this is a reading exam. You need to be able to read each and every word carefully. You need to be able to gain an understanding of what you're reading and draw inferences and synthesize information so that you could come up with the best answer response. All right, now for the good stuff, right? If you can, take a moment. I hope you guys can see this clearly. If you can, take just a quick moment and read through this practice question and then select your answer choice and just put it in the comment section. We'll talk about it quickly. So I'll give you about a minute and then I'll move forward. All right, so let's see what we got going on here. You are a clinical social worker providing psychotherapy. Your client's mother passed away 6 months ago. In a previous session, your client shared with you that although her mother battled cancer for more than 3 years, she knew that she would pass away soon because her cancer had taken a turn for the worse. In today's weekly scheduled session, the client said to you, "I really feel depressed this week." How should the social worker respond in a way that shows empathy? A, it seems like lately you've had a lot of difficult things to deal with. Let's talk about what might have happened this week that was particularly hard for you. B, it's not strange for you to be feeling sad. You just lost your mother to cancer. C, I'm sure you're feeling awful and still grieving. Death is difficult for anyone to handle. D, I'm sorry, that was C. D, with your mother's death and all the things you have to face, perhaps you're a little let down right now. So, reading those 4 answer choices and reading the vignette, what would you say would be the best answer response, right? All right, if anybody has enough courage to go ahead and select their answer and write it in the comment section, then go ahead and do that. That will give me some guidance on how to kind of end this and kind of dialogue with you all about what's going on here. So how about we take another 10, 15 seconds just to put our answers up if you guys have enough courage to do so. All right, looking good. Okay, thank you. Okay. So let's take a look here. So you are a social worker who's providing psychotherapy. Your client's mother passed away about 6 months ago. Okay. In a previous session, your client shared with you that although her mother battled cancer for more than 3 years, she knew that she would pass away soon because her cancer had taken a turn for the worse. All right, so she's telling you, you know, she told you this before in a previous session, not in the session that she's currently in. But today, in your session with her today, what did she say to you? She said to you, "I really feel depressed this week." Okay, so that's significant, right? She's telling you, I really feel depressed. And the STEM is asking you, how should the social worker respond in a way that shows empathy? Now, this here particular question is very particular, right? And it's asking you for a particular type of a technique, right? How do you respond to the client showing empathy? Now, in order for us to be able to respond back, empathetically, we need to understand what empathy means. So this is pretty much a question that's dealing with a clinical intervention, a treatment intervention, some type of intervention. So how do we intervene? How do we respond back? How do we give a response that's going to show that we are there, we are hearing her, we are understanding her, but we are not going to a point of trying to tell her what's going on with her, right? And from the looks of it, it looks like everybody is going with answer choice A, which is actually the correct answer. Now, remember, when you're thinking about empathy, in order to answer this question, you have to understand what empathy is. Not only do you need to understand what empathy is, you need to also understand what actual response or what actual statement in this vignette that has been shared with you is the statement that you need to respond back to, and particularly empathetically. Okay, is it that, because she's already given us information on her mom passing, is it that we're responding to? Or is it the fact that she's, telling us that she's feeling really depressed today, right? Or this week, rather. And because she's saying to us that she's feeling really depressed, this is what we need to be responding to. This is what we would consider the problem or the issue or the situation that we need to immediately be addressing. The fact that she's telling you, I feel really depressed. Okay, now it's our responsibility, because the vignette is asking us, how should we respond in a way that shows empathy? We need to be able to give feedback to her in such a way that lets her know that we heard her and we understand. What did we hear? We heard that she's feeling depressed, and that's all we heard. And so that's what we need to respond to. And so given the 4 answer choices, A is the best selection here. A shows, or A is stated in such a way that it shows empathy. We're not jumping to conclusion, nor are we telling her how she feels. B is incorrect, because here's what it says. It's not strange for you to be feeling sad. You just lost your mother. Well, she says she was depressed, but she didn't tell us why she was depressed. And for us to assume that she's depressed because her mother passed away 6 months ago is us jumping to conclusion. We need to allow her to let us know what it is, or help her with identifying exactly what it is that's making her feel depressed. We don't want to put that language in her mouth, but we want to assist her and help her uncover what's actually causing her depression. So B would not be the best answer choice. Let's look at C. I'm sure you're feeling awful and still grieving. Death is difficult for anyone to handle. Well, she might be grieving. She may be grieving, but that might not be why she's feeling depressed, okay? And so again, answer choice C is jumping to conclusion, and we're just making the assumption that she's feeling depressed because she's still in a state of grieving. Everybody goes through a very different phase of grieving, yeah. And so we can't make that assumption for her of where she's at in a phase of grieving, or whether or not she's still grieving. Again, it's up to her to be able to identify or share with us, or find, the source of her depression. And then D, with your mother's death and all the things that you have to face, perhaps you're a little let down. And again, this answer choice D is again assumption, and is jumping to conclusion, and we're answering too quickly. And at the end of the day, what I keep coming up with is that it's really important that we let her identify what's triggering the depression, and we are there to assist her through that process. And so out of the 4 answer choices given, the best answer choice is A. When you're presented with a generalized statement, it is important for you to refrain from jumping to any conclusions when interpreting the client's communication without obtaining clarification first. Although the client may be feeling bad as a result of losing her mother, it is also possible that the client is referring to something unrelated to that event. So don't jump to conclusions or make any assumptions about what she's feeling. Let her identify or clarify for you what's making her feel this way. And so that's all I have for tonight. Thank you all for joining me. I really do appreciate that. If you want any more in-depth analytical skills and reasoning skills, you can always reach out to me at my web address, which is right here below, www.bridgetmontgomeryllc.com/tutoring.html. And you do not have to, but I thought it was just important for me to put in here. I am also accepting new students right now for one-to-one tutoring. If you have any questions, you can leave it in the comment section, and I'll do my best with responding to you guys, or you can try and reach out to me via email. Okay. I hope this was helpful, and I will jump back in and talk to you guys next time. Have a great night. That motorcycle is driving me crazy. He's just up and down the street making all that noise. But anyway, guys, you have a good night, and I will talk to you soon. Bye.